for yielding because there are three things about this bill that allow for the federal funding of abortion and, in fact, can require it. Number one, until now, all plans regulated by the House of Personnel Management have been required to exclude non-federally covered abortions. So the Senate bill allows all but one of the federally subsidized health care plans in each area to cover abortion. They'll say, now, you may have one plan that doesn't take care of people like it needs to. We'll offer one plan over here that probably nobody's going to want to buy that will not cover abortions. But the plans that may well be what most people need will cover abortions. So if you want to buy the plan that you're going to need, then you're going to have to cover abortions. That's one thing that's very clear. So that's one way. Second way, under this Senate bill, it authorizes and appropriates billions of dollars in new funding outside the scope of the appropriations bills covered by the Hyde Amendment. And the billions of dollars, it's here. This is under Section 10503, Community Health Centers and the National Health Service Corps. Well, I don't want to make the president look bad, so I'll call it Corps also. The Service Corps Fund, subsection B, funding, there is authorized to be appropriated, and there is appropriated out of any monies in the Treasury, not otherwise appropriated, to the CHC Fund, that's Community Health Center Fund, and then subsection 1 of that to be transferred to the Secretary of Health and Human Services, provide enhanced funding for the Community Health Center program. And then it's these amounts: $700 million for fiscal year 2011, $800 million for fiscal year 2012, $1 billion for fiscal year 2013, $1.6 billion fiscal 2014, and $2.9 billion for fiscal year 2015. Now, the reason that's significant is that the Hyde Amendment, which is existing law, only pertains to money appropriated, actually appropriated in the Labor and HHS bill. This money is not being appropriated in the Labor and HHS bill. It is not covered by the Hyde Amendment. And that's why I'm sure that it's got to be ignorance instead of the lie that David Axelrod is demonstrating. He probably doesn't realize that the Henry Hyde Amendment only pertains to money appropriated through Labor and HHS. This is separate money that is not restricted, and so it can go to community health centers to provide abortions. That is allowed under this bill, and people need to understand that. And then one third route
the gentleman would briefly yield.
Yes.
House or Senate version of the bill, Mr. Gohmert?
Pardon?
Is that out of the House or the Senate version?
This is the Senate bill. This is the one that the House is expected to vote on this week, maybe Saturday. This is the bill that the House is going to vote on. So anybody that comes in here and thinks or has been sold a bill of goods, because so often if you don't read the bill and you allow somebody to tell you who you think may have read the bill that, oh, no, that's not, oh, no, it doesn't change existing law. They just don't know. It does change existing law. You just have to read it and understand the implication of the Hyde Amendment, what's covered, and that, the implication here. But there's another thing, too. Section 1303 of the Senate bill that we're expected to vote on only limits the direct use of federal tax credit to fund abortion coverage. The credit still could be used to pay premiums for health care plans that allow abortions. So the federal tax law, the federal tax dollars through their credits are going to fund health care plans that allow abortion. That's a third way that the Senate bill we're going to supposedly vote on the end of this week will fund abortions. Now, I know there are people in this body who think that's a great thing to fund abortions with federal funds. Others who, like me and my friends here, believe that's not appropriate, to take money away from people who know in their hearts it's murder to kill an unborn child and make them take their tax dollar and pay for abortion. That's been the law of the land for over 30 years, and it is changed dramatically by the Senate bill. And people just need to understand, if they're going to vote for this bill, or they're going to vote for a rule if it's self-effectuating, then they are going to vote for and bring into effect a dramatic change to the law on federal funding.